This video will review the new features associated with MATRx version 3.0 titration trays and discuss how these features can be used to enhance the fit and function of the trays. Properly fitting titration trays should not extend beyond the last half of the last tooth. For some patients, this means the trays must be trimmed. The first new feature is the addition of raised lines on the molar end of each tray to assist with this process. These lines are called trim lines, and they have been added to help guide the dentist and ensure maximum patient comfort and range of motion. You will find these trim lines on both the upper and lower trays, and they can be found on both the medium and large sizes. In many cases, tray trimming may not be required, but if adjustments are needed, it is always a good idea to ensure that there are no sharp edges on the tray before reinserting the tray in the patient's mouth. The trim lines will now make it easier for you to quickly and accurately adjust the trays to ensure the best outcome for your patient. The second feature added to the new titration trays is the addition of a small V in the front of both the upper and lower trays. This feature is known as the incisal groove, and it has been added to assist with the quick and easy conversion of a target protrusion, also known as the MATRx number, into a therapeutic position for an oral appliance. This feature will automatically center the patient's teeth in the middle of the upper and lower tray. This allows the dentist to create an edge-to-edge position from which to reference the MATRx number. We refer to this edge-to-edge position as the reference number. To determine the reference number for a set of titration trays, connect the upper and lower trays and place the incisal grooves from the upper tray over the lower tray. Holding the tray up to the light can help in lining up these grooves. Once the grooves are lined up, take a scale reading using the red indicator line on the upper tray. This number is the reference number and represents your patient's edge-to-edge position. Prior to taking impression, it is important to record the tray's reference number in the patient's record, as this number will assist you with quick and effective fabrication of a custom oral appliance. Once you have taken an impression, always make sure the incisors are positioned midline with the groove and check for adequate bite depth to make sure the patient's incisors are in contact with the bottom of the tray. The addition of the ability to create a reference number now gives you two options for converting the MATRx number to an appropriate position for a custom oral appliance. Using the reference number, you can calculate the target protrusion based on the reference number or edge-to-edge position, as shown below. Or you can continue to use the maximum voluntary protrusion as your reference point, as shown below. Regardless of which approach you use, with MATRx you can have confidence in the therapeutic benefit of oral appliance therapy for your patient.